All right. Going to the next one, a client who began taking colchicine for gout 2 weeks ago returns to the clinic for a follow-up visit. Which client statement requires immediate follow-up by the nurse? So the focus of this medicine here is colchicine, and we know that is for gout, okay, colchicine for gout, and we are looking for immediate follow-up. So when it says immediate follow-up, we know that we are looking for something bad. Okay. So what is something which require my attention right now as a nurse? Okay, what am I worried about? The client is saying, number one, my muscles feel sore and weak. Number two, I'm taking this medicine with my meal. Number three, I still have some swelling on my toe. And number four, I'm not drinking grapefruit juice anymore. Okay. Now, because it's only 4 options and it's not a select or that apply question, so we will have to take only one option from here. Now, let's see which one can we eliminate. I'm sure that we know that I still have some swelling in my toe. I will eliminate that because the patient has gout, and swelling in the toes are part of gout. Now, this patient began taking it just 2 weeks ago, and it says I still have some swelling. So I'm thinking that it is better, but it didn't go away completely, but it's better. So it's kind of expected with that, right? The medicine is working. It's going to take some time maybe. So 3 is definitely not. And I'm not drinking grapefruit juice anymore. I think that's another one I'm going to eliminate, because in most of the cases, when it comes to grapefruit juice, we know the grapefruit juice has grapefruits, and grapefruit juice has those enzymes in it. It might interfere with the absorption of many medications. Okay, the only one which comes to my mind where it's not a problem, I mean, from an NCLEX point of view, is metformin. I mean, metformin, you can take it, and grapefruit juice is not going to do anything with it. Okay, it's fine. But all the other cardio medicines and all kinds of what can we say, like the antihypertensive medications and these kind of colchicine and things, grapefruit juice interfere with all those problems, all those medications. So that's also avoided. Okay, now let's think about, let's talk about this colchicine and come back. If you can remember GRIB, G-R-I-B, that's all you need to know for NCLEX when it comes to the questions on colchicine. Okay, remember GRIB, G-R-I-B. Now, first is G, which means there can be GI toxicity and no grapefruit juice, and gastric distress can happen. So take it with food. Now, seeing this, I would say taking this medicine with my meal is a good thing to do. And we are not looking for good things. We are looking for bad things. So definitely 2 is not my answer. Okay, so the next one is R for rhabdomyolysis. Okay, I see that some of you guys are already answering that, which is great, because this medicine can cause rhabdomyolysis, which is muscle breakdown and muscle pain and tenderness. And if the patients are saying that, we need to reevaluate and notify the doctor, which needs more follow-up. Okay, so rhabdomyolysis can, if it is not treated, if we don't identify it and if we don't treat it, it can lead to kidney failure, because all this creatinine and all those things, it can be too much, creatinine kinase. So the kidneys are the ones who are going to suffer. And because of that, we will have to take some measures to see what's going on. And that's why 1 is going to be our answer in this case, because the patient is saying here, my muscles feel sore and weak, which is not okay. Right? So remember GRIB, G for gastric, okay, and R for rhabdo. I is infection. Colchicine can kind of suppress the bone marrow, and whenever there is bone marrow suppression, your chances of fighting the WBCs and everything will be down. So that's why patients who are on colchicine, should take extra care to avoid being with sick people or being in environment where there is a lot of sickness. So they have to take measures. Obviously, start with hand hygiene. Okay, maybe they need to wear masks when they are going out in public places where there could be a lot of people. So very important to take care of that. Make sure that they take all the immunizations as needed, because we don't want any kind of infection. And from an NCLEX point of view, the way the NCLEX is going to say that there is some kind of infection is by saying there is sore throat. So if the patient who is taking colchicine is complaining of sore throat, it's not in our question. I'm just giving additional information here. So if there is a question about colchicine and the patient is complaining about sore throat, we may have to look into that because it could be an infection and we need to figure out what's going on. Okay. Now, the last one is bleeding, and that is also a side effect. Now, see, the patients are probably not going to come saying that, oh, I am bleeding. Instead, they might say, I have bruises, or my stool is looking dark and black. Or maybe they will say that my gums are bleeding or something like that, which gives you an idea that there is some kind of platelets are going down and there is bleeding going on. Thrombocytopenia means thrombocytes are platelets. Penia means it's the numbers are down. So thrombocytopenia means low platelets. This medicine can lower the platelets. Now, when there is not enough platelets, your risk for bleeding increases, right? So that's what we are worried about. So remember GRIB, G-R-I-B, whenever you think about colchicine, which is a gout medicine. Now, the same colchicine can also be used off-label for something else, and it's for pericarditis. Now, these are additional information. We don't need that for our question, but just keep in mind, in case you see that a patient is having pericarditis, which is inflammation of that membrane covering the heart. So if there is an inflammation there, they might use colchicine to kind of help with that. The side effects remains the same. Okay, so still the side effects are going to be G-R-I-B. Okay, so now that we learned that, what's going to be our answer? I'm sure everybody know the answer right now. The most important thing we have to kind of think about here or immediate follow-up is our first one. My muscles are sore. Okay, great. Muscles are sore and weak. Right? Any question? Are we okay? Are we okay so far? Anything else I can help you with? Is that making sense? Okay, let's go to the next one. Stop me if you need to ask anything. Okay, feel free to just type it in the window, right? And we'll talk about that. Okay, let's do the next one here. A nurse is performing a follow-up assessment on a client who began taking Ramipril for hypertension. Which client statement indicate a need for further teaching? We are doing a lot of negative questions here. Negative questions in the sense need for further teaching, because those are important to be like practiced with, so we don't make any silly mistakes. Okay, so which one need for further teaching, which means we are looking for something bad. Okay, we are looking for something bad. And we have 4 options here. Number 1, I feel lightheaded when I stand up, so I sit on the edge of the bed before getting up. Number 2, if I get a dry, tickling cough, I need to let the doctor know. Number 3, I should eat foods high in potassium to help my heart. And number 4, I should take this medicine even if my BP is normal. Okay, let's think about it. And I see that your answers are coming. Okay, 3, all right. So let's think about it. And I know there will be some of you who might be still not sure about the answer. So what is it? Well, we are looking for something bad. And I think I can eliminate number 1. Okay, it's a good thing, right? I feel lightheaded when I stand up, so I sit on the edge of the bed before getting up. That's a good thing to do, because we know Ramipril is given for hypertension. Now, what kind of medicine is ramipril? What is the group where ramipril is going to be with? Yes, it's an ACE inhibitor, right? So we know that hypotension can happen. I mean, whenever somebody is taking some medicine for blood pressure, it can come down so quick and people may feel lightheaded and dizzy. And it's a good thing to do. And because it's a good thing to do, it's not going to be our answer. Okay. Now, I should take this medicine even if my BP is normal. I would say that's a good thing to do because we don't want them to stop taking the medicine whenever the blood pressure is normal. Actually, their blood pressure is normal because they are taking the medicine, right? So they should continue taking it. And because we are looking for something bad and this is good, it's not going to be our answer. So far, so good. Okay, now it'll be between 2 and 3. 2 says, if I get dry cough, tickling cough, I need to let the doctor know. And that's yes, they should let the doctor know because let me tell you this. Oh, not that. Here, this is the side effects of ACE inhibitors. And you can see that there is cough because the ACE, which is angiotensin converting enzyme, that enzyme is needed to remove a substance called bradykinin from our body. Okay. Now, when there is no ACE inhibitors, because we are doing ACE inhibitor, right? ACE inhibitor, right? So when you're using that, we are kind of inhibiting or stopping or blocking the ACE, which is the enzyme, angiotensin converting enzyme. So when we block that enzyme, it is not going to remove that bradykinin, and bradykinin kind of builds up, and that causes the cough, and that causes this irritating cough, which will not go away. So that needs to be reported because maybe we can switch them to kind of the same kind of category medicine, antihypertensive medicine, but a little different. And that's called ARB, angiotensin receptor blocker. So we can use that instead of ACE inhibitors because angiotensin receptor blocker let that angiotensin converting enzyme come, but it just blocks the receptor. So the enzyme is still there, and we just need the enzyme to take care of the bradykinin. Okay, so we discussed all this again in detail in AppleRN course. So if you are there in the pharmacology session of AppleRN full course, you will see all this explanation in detail. But cough is something we need to report. So that means 1 is not our answer, 2 is not our answer, 4 is not our answer. So the answer is 3. But I want to give you a proper explanation on why 3 is the answer. It says I should eat food high in potassium. And it's ramipril, which is anything pril, P-R-I-L, that's an ACE inhibitor medicine. So this medicine, as we know, it inhibits angiotensin converting enzyme, right? And like I said, angiotensin converting enzyme is also needed in our body because that's the enzyme which stimulates and the conversion of angiotensin 1 to angiotensin 2. And that's how adrenal gland gets the message to produce aldosterone. Now, adrenal glands are this teeny tiny glands which are on top of our kidney. So we have 2 of them, adrenal gland. So whenever this adrenal gland is stimulated, it produces a hormone called aldosterone. Now, aldosterone is super important because aldosterone pushes the potassium out of our body. Okay. Now, what happens when we give an ACE inhibitor? Okay. So that's like, this is ACE. Okay. Angiotensin converting enzyme, that's ACE. Now, what if we give an ACE inhibitor? Like any of this pril medicine, lisinopril, ramipril, right? So those kind of enalapril. So those kind of pril medicine, when we give it, we are going to block that. So the adrenal gland cannot produce enough aldosterone. So the potassium is not getting out of the body. The potassium is going to stay. Okay, for potassium, okay? So potassium is staying in the body. When we use ACE inhibitor, this doesn't happen, so potassium stays, which means the patient is going to have, most of the time, one of the side effects you will see is potassium retention, and patient will be having hyperkalemia. Potassium stays in the body when we use ACE inhibitor. Okay. Now, if someone is going to have hyperkalemia, do we want them to take more potassium? And the answer is no, right? Because it says I should eat food high and rich in potassium. No, we don't want you to eat high potassium food because you are already holding on to the potassium. It can be really bad for the heart. Okay. And because of that, and because we are looking for something bad, need for further teaching, something bad, we are going to select 3 as our answer. Okay. Are we good with that? Is that clear? Okay. We good? Anything clear? Okay. So let's see. Somebody is asking me. Okay. Yes. Thank you. All right. Okay. Okay, great. Yeah, all of this, this is actually application questions we are doing. All this explanation and more is already there in the AppleRN full course. This is more questions, different questions. Okay. Okay, and a little bit more explanation because we have a lot of people who are just trying to see for the first time. And I wanted to make sure that we discuss a lot of important questions here with pharmacology. Great. So 3 is the answer. And let me show you the answers for any kind of side effect questions you ever get for ACE inhibitors. Okay, this is just for the ACE inhibitors. Okay. Remember PEACH, P-E-A-C-H. P is for potassium retention. So don't give potassium-rich food. Okay. E is it can elevate lithium level. So lithium is a medicine which we use as a mood stabilizer, like a psychiatric medications. Patients with psychiatric problems may be on this medicine. Like bipolar disorders and all. So lithium, if someone is taking lithium and they are on this, they may have hypertension too. So if we are giving this ACE inhibitors, we need to make sure that we check the lithium level more frequently because this medicine kind of elevates the levels of lithium. Okay, so that is E. So P is for potassium retention, hyperkalemia. E is for elevation of lithium level. And A is angioedema, which is like you're swelling in the lips and this area, it's like that is the priority emergency if that happens because it's airway obstruction, right? So we have to be very, very careful with that. And cough, like we mentioned. And then because it's a hypertensive medicine, the blood pressure can go down. And that's why we are worried about the hypotension, orthostatic hypotension. And patients may feel very lightheaded. So we need to put that all precautions on the patients. Okay. And it can, if somebody is already like a diabetic patient, it can in fact create problems and patients may have their blood sugar changes. Okay? And we need to make sure that the patients are aware about it. Okay, so they have to take. All right. So all good. And I think we are good with that. Okay. Shibi is asking, please explain why 2 is not the answer. 2 is not the answer because it's a good thing, right? We are looking for a bad thing. Does that make sense? Because the patient is saying, if I get a dry cough, I will let the doctor know. Is that a good thing? Yes, it's a good thing. We want the patients to let us know because we may have to change that, right? Change the medicine into herb, right? Okay, that's why 2 is not the answer. Okay, so somebody is asking, cannot use with the diabetic. Oh, they can use with the diabetes patients, but the problem is they have to be extremely careful with the other diabetic medicines they are using. right? Because it can cause hypoglycemia, right? So they need to know how much insulin are they taking. They need to monitor the blood sugar a little bit more closely because there is an additional medicine which is interacting. So we will not be saying that, oh no, you cannot use it. You can, just make sure that it's there. All right. Okay. Zaubagya is asking, what about CKD patients or kidney patients, chronic kidney disease? If they have hypertensive problem, this medicine can be used. However, remember the side effects. How advanced is the kidney disease? Because most of the medicines, I mean, even if you think about diuretics, they are nephrotoxic, right? But we still use it for kidney patients because it's a risk versus benefit. So just like that, these medicines can also be bad for the kidney because it talks about potassium and all. So, but we have to be careful about how bad is the kidney. All right. Okay. All right. So I think I answered most of them. Does beta blockers mimic hypoglycemia? No, 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 no. Beta blockers does not mimic hypoglycemia. So what happens is, Digi is asking, what happens is, let's say if there is hyperglycemia, oh sorry, hypoglycemia in a patient, it's a diabetic patient having hypoglycemia. What are the symptoms usually? How does the patient know that they are having hypoglycemia? They are going to have maybe like, tachycardia. They feel like there's something wrong and they feel lightheaded and they feel like tremors, right? Like they are shivering a little bit. That's how usually patients, diabetic patients, that's how usually they know that they are experiencing an episode of hypoglycemia or low blood sugar. Now, if they are on beta blockers, what happens? They will not have any tremors. They will not have any tachycardia, right? Because beta blockers will reduce the heart rate. Beta blockers will, reduce the tremors. So they may miss it. Okay, so this patient who is having hypoglycemia is actually having it, but they may miss the symptoms or identifying the symptoms because the beta blocker was there. Okay, so that's why it's not good. I mean, it's okay as long as they know. We are not saying that you cannot have beta blockers if you're diabetic. No, that's not what we are saying, because beta blockers have really good effects on the heart and blood pressure. But we need to monitor them and teach them. That's our responsibility as nurses. We need to teach them. Be very careful about the hypoglycemia, because don't look for that tachycardia and tremors. It may not happen, and you have to monitor your blood sugar more closely. That's what we're going to do. Okay, great, great. Okay, so I think I am answering everything which you answered. Oh, Mariam, thank you so much. Appreciate that. Mariam is explaining why floor is not the answer. Good job. Okay, let's go to the next one.